Dr. Mora here at Orthopaedics and Spine Center. I wanted to show you another case. This is a full head-to-toe evaluation, highly detailed AP lateral, very useful X-ray here that allows us to measure angles and check leg lengths, check angles. But the beautiful thing about this is that that this device provides a low dose, full body radiographs in functional position. So this is taken in standing position, and the reason why it's so detailed at every level is because the device shoots two perpendicular fan beams of X-rays. They just come down like this, boom, 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 and come back up, and that's it. And then you walk out of the device, and this is what we're able to do with it. We're able to check curvatures of the spine, pelvic tilt, and that's what my partners do. They are scoliosis experts, and what I do with this is look at lower extremity anatomic axis. I check the weight-bearing line, so I can draw a line all the way from the center of the hip to the ankle. Alter it right there. I just changed to the center of the tibia. See how I was able to do that? And then go back up to the head and make sure that I'm at the center of the head, or as close as I can be. Boom. And that would allow me to see where the weight-bearing line is, which is very nice over here. And then the other thing I can do with this is check, for example, anatomic axis, and that's basically drawing a line down the femoral shaft. Boom. Let's do that one more time. There we go. There we go. And then another one over here. Down the shaft of the tibia, down the center. There, and it gives me the degrees of the anatomic axis. This is just one example of what can be done. And another very simple thing that can be done is checking leg lengths. So drawing a line from the top of the femoral head all the way to the joint down here. And as you can see, the measurement will be there. And it tells me what it is. So I'm going to clear all this. So once again, leg lengths, angles, tilt, and then in this side over here, you can check kyphotic angles, weight-bearing lines as well. Once again, this is the EOS Imaging System. We have it here at Restore Orthopaedics and Spine Center. It's changed the way we do things here. It's improve the quality of care and service that we provide at Restore Orthopaedics and Spine Center by providing patients ability to do full-length imaging with very little radiation and with extreme accuracy. Thank you so much.